So we are being joined by many of our attendees, and we will be live in Facebook, we'll be live in the YouTube. So few will be joining from there also, and few from the Zoom platform. Once again, on the behalf of Walter Bushnell, I would like to thank all of you who are being a part of today's afternoon webinar on a very interesting topic of lactose intolerance.
Dr. Baksla?
Yeah.
So for the participant, we are now live on YouTube also.
Yeah. And today also happens to be a very auspicious day. Today happens to be Guru Purnima. So today is the day when we give our tribute, and we are grateful to our gurus who have been instrumental in shaping our lives and career. So today we have with us a very renowned gastroenterologist. I'm sure most of you have heard his name. Sir, it's Dr. Deepak Lahoti. He is a very renowned gastroenterologist of India. Uh, I take this opportunity to introduce him. Sir is Senior Director and Head of Department Gastroenterology, Hepatology, Endoscopy, Max Hospital, Patparganj, Delhi. Previously, he was associated as a Director, Delhi Gut and Liver Clinic, New Delhi, Senior Consultant Gastroenterology, Sant Paramanand Hospital, Deepak Memorial Hospital, and Northern Railway Central Hospital, New Delhi. He was also associated with RML Hospital, St. Stephen, PSRI, and formerly the Department of Gastroenterology, GB Pant Hospital. Sir has successfully performed various diagnostic and therapeutic procedures, including upper GI endoscopy, colonoscopy, ERCP, ultrasound, stricture dilation, varicose ligation, injection, polypectomies, and innumerable procedures in gastroenterology. Sir graduated from Maulana Azad Medical College and post-graduated from LHMC and RML Hospital. And then he super specialized in gastroenterology at the DM from GB Pant Hospital, University of Delhi. He has many awards and recognition under his name and to credit. To name few of it, he was awarded as National Science Talent Search Scholarship, OMGE Young Investigator Award in 1994, and attended 10th World Congress of Gastroenterology as Los Angeles, USA, and also presented 2 papers. He has also got Best Poster Presentation Award at 37th Annual Conference of Indian Society of Gastroenterology at Chandigarh in 1996. He has organized various conferences and events both at the national and at the international level. He has been organizing secretary at Transfusion Associated Hepatitis I Insult in December 1996, organizing secretary midterm conference of acute pancreatitis 1998, and he also organized a single theme conference on transfusion associated hepatitis. And he is a member of the Indian Society of Gastroenterology, Indian Association of Study of the Liver, Society of Gastrointestinal Endoscopy on India, and Diabetic Association of India. Sir has numerous publications on his credit in national and international journals. On behalf of all the audience who have gathered for this evening webinar, I welcome you, sir. Sir, now I hand over the session to you for today's webinar.
Can I share my screen now?
Yes, sir. Yes, sir.
Okay.
And I request all the audience, in case if they have any query or if they have any doubts, if they want to ask sir, they can post their queries in Q&A sessions. So we begin our webinar. Welcome, sir.
First of all, thank you for your kind introduction, which I do not deserve. And secondly, congratulations everybody on Guru Purnima. And as you said, we owe a lot of achievements in our life to our gurus. Their simple teachings made us, what we are today. And we would ever be grateful to them for parting this skills, this knowledge with us. Okay, so today we are going to discuss a very simple topic. It is simple, and till the time you guys approached me to speak on this, I was really unaware that this lactose intolerance could be so diffusely present in our patient population. The symptoms which we deal with every day: bloating, gaseousness, excess farting, or upset stomach after eating outside or eating a heavy meal, they are so common. I think everybody who walks into your clinic has these complaints now or some other time in the life as symptomatic problems. But we hardly consider lactose intolerance in our busy practice. We always, we are reminded of bigger problems like irritable bowel syndrome, bacterial overgrowth, and blah blah. But we hardly think of lactose intolerance as one of the contributing factors to this symptomatology. And on premise of this, I'm going to build up this talk. It, it is a very simple and brief talk, and let us skip this. I am going to present a case. This is a 23-year-old female patient presented to clinic with complaints of occasional abdominal discomfort, pain, and bloating after meals for last 5 to 6 days only. It was not a very long standing complaint. She was symptomatic only for last 5 to 6 days. She reported that discomfort was first raised about 1 week back, an hour after she had a cheeseburger and a large chocolate milkshake outside her home. Currently, she came to seek medical attention after she felt that her abdomen has cramping pain. She cannot work, she cannot move about because of this bloating and abdominal cramps, but she had no nausea and vomiting. So, based on these complaints, one could think of food poisoning, one could think of bacterial or viral gastroenteritis. And on those lines, she was investigated with routine blood test. Fecal occult blood test was negative, stool culture was negative, and then we thought of lactose intolerance, and we got lactose tolerance test and hydrogen breath test. We will come to these tests a little later, but I must here confess that these tests are not at all necessary in day to day practice, and we will also discuss why they are not necessary and how can we diagnose lactose tolerance without going for sophisticated tests. An endoscopy was found to be normal. So, on basis of history, examination, and investigation, she was suggested that there is no serious problem, but she has developed lactose intolerance. Okay, the patient was given enough knowledge about lactose intolerance during discussions. She was also advised to take 2 chewable tablets of lactase enzyme with milk or milk products whenever she consumed. Okay, symptomatically, she was given antispasmodics. She presented for follow up 3 weeks after with significant improvement. She was asked to continue with the treatment. And when she was actually uh, interviewed a little more in detail, she also revealed that she had similar but much milder symptoms in the past also whenever she consumed heavy quantities of milk or milk products. So let us now uh, see how do we manage lactose intolerance. Before we are able to manage, we must have some more basic knowledge. Lactose is present in the milk. It is the sugar of the milk, and it makes up around 2% to 8% of milk mass. Now, the lactose quantity is different in different kinds of milk. We also drink cow's milk, buffalo milk, in addition to our newborns drink human milk. So the lactose quantity is 7.2 gram per 100 ml in human milk as compared to 4.4 or 4.7 gram of cow's milk or buffalo milk. Please be aware that nowadays we are also getting reconstituted milk through Amul or through Mother Dairy, etc. The content of lactose will be different in reconstituted milk. So let us have a look. We have different kind of milk or milk preparations available in our kitchen or markets, and let us see what is the lactose content. 1 cup milk, 12 grams lactose. If you take evaporated milk, 1 cup, 24 grams. Sweetened condensed milk, 40 grams. Okay. Milk powder, 1 cup, 62 grams. Very heavy in lactose. Ice cream, a small cup, 12 grams lactose. And if you take yogurt, 1 cup contains 5 grams of lactose. Similarly, ordinarily, tea and coffee, 6 grams of lactose. Great Indian sweets like barfi, sandesh, each piece will have 12 grams of lactose. Firni, 16 grams of lactose. Now, these are some other food items uh, which we keep on having in the restaurants, especially rice milk kheer, 18 grams per 100 grams, gajar halwa, 15 grams of lactose per 100 grams, dal makhani, 6 grams, and malai kofta, 8 grams. So it all depends, what kind of food we are taking. If we are taking too many milk-based items, our lactose intake is going to be very high. So, what is lactose? Lactose is a disaccharide. That means it is made of two sugars joined together. And what are these sugars? These are glucose and galactose. So, when we ingest lactose, then we have an enzyme in duodenal and small intestinal mucosa, and this is called lactase. It is a disaccharidase, and this is present on tip of the villi. So what happens to lactose? When it reaches duodenum or small intestine, it is broken down immediately into two molecules, one of galactose and other of glucose, and both are absorbed. But if lactase enzyme is absent or deficient or insufficient in amount, what will happen? Lot of lactose will remain undigested. And this, along with food and peristalsis, will go down to distal small intestine and colon ultimately. And in the colon, there are large number of bacteria which will act upon lactose. These bacteria may have some lactase, but most of them end up breaking down our lactose into hydrogen and carbon dioxide gases, as well as few acids like lactic acid and acetic acid. Now, uh, the unsplit lactose in the colon, it is by virtue of its osmotic power, it draws water into the colon, and this leads to abdominal pain, abdominal distension, diarrhea, borborygmi, flatulence, nausea, and vomiting. And these are the very symptoms which everybody has after eating high amount of lactose, especially in restaurants, in parties, or in marriages. So there are multiple kinds of lactase deficiencies. Okay, there are four kinds, and often at birth, the only feed which is available to the infant is mother's milk, and mother's milk contains lactose. And you must be knowing that many of the children develop bloating, burping soon after mother feeds the baby. And this is again because of lactase deficiency. So in a newborn child, lactase may be inherently deficient, but as the child grows, the lactase starts getting produced. By 5 to 6 months, sufficient lactase is there, and you also would realize that by 5 to 6 months of age, most of the infants have stopped produced burping. Okay, so they can digest mother's milk much better at 5 to 6 months of age. After the age of 5 to 8 years, that means once you are school going and a little later, then the lactase enzyme starts decreasing, and this is a genetic program. So, in barring a few, most of us will have lactase enzyme in decreasing amounts as we age. The other reasons for lactase deficiency are primary lactase deficiency are congenital ones. Okay, this is a very rare form in which lactase is completely absent, and this is because of a genetic defect. Then developmental lactase deficiency, which we already have described, which occurs in newborns, and then there is something called lactase non-persistence, which is comes with aging, and it is a normal phenomenon. But can we have secondary causes of lactase deficiency? Yes, as we, we have learned that lactase lives in tips of the villi. And if you damage duodenal or small intestinal mucosa, you also damage these villi. So, in diseases which affect small intestinal mucosa, like inflammatory bowel disease, acute gastroenteritis, radiation, cancer chemotherapy, and GI surgery, etc., they all result in secondary lactase deficiency. Okay, I think we can skip this. So there's many workers have tried to find out the prevalence, and surprisingly, it is not uncommon in North India, depending upon the dose of lactose used in these publications. Workers found that almost two-thirds of North Indian population and almost 90% of South Indian population was lactase deficient. Similarly, if you use 50 gram of lactose, one-third and two-thirds of population of North and South India respectively were lactase deficient. So lactase deficiency is not uncommon, but you don't see many people complaining every day except mild symptoms. This means that the symptoms are non-specific and sometimes they are overlooked, but it does not mean that the person is not deficient. If the same person is challenged with high doses of lactose, then you will find that the symptoms will become apparent. Worldwide, the lactase deficiency uh, prevalence varies from 15% to almost 100%, depending upon the eating habits. Once again, I am emphasizing that if you do not take milk or milk-based diet, then even if you are lactase deficient, this will not become clinically apparent. Only when you challenge your intestine with milk or milk based diet, you will have symptoms. As we discussed few moments back, there is a threshold for symptoms. If you are partially deficient, let us see, say you are a 10-year-old boy, you have partial decline of lactase in your intestinal mucosa, then and you are your mother is giving you 1 cup of milk every day, and you are able to digest. But when mother says no, please take 2 glasses of milk, you are a growing child and you start taking that milk, and you have bloating because you cannot tolerate 2 glasses, you could tolerate 1 glass. So there is a threshold for lactose intolerance, and most of us will tolerate up to 12 grams of lactose as a single dose with no or minor symptoms. But there are people who will develop symptoms with as low as 3 grams of lactose. So this is the frequency of various types of symptoms: abdominal pain, distension, borborygmi, flatulence, nausea, vomiting, diarrhea, all sorts of symptoms which raise suspicion of one or other disease uh, apart from lactose intolerance. And that is why there is so much of confusion in diagnosis. When we want to diagnose, we can use hydrogen breath test, but this is not available everywhere. Lactose tolerance test, this is very simple. Give 50 grams, measure blood sugar, and if blood sugar does not rise, it means that there is lactose intolerance. Stool acidity test, this is very popular amongst pediatricians. You check the pH of the stool. If it is acidic less than 5.4, it means possibly there are reducing substances and lactose intolerance is high on cards. Okay, genetic testing is very rarely needed and very rarely used. So the diagnosis of lactose intolerance you can actually make sitting in your chair in your clinic. There is no need to uh, subject the patient to very sophisticated tests unless you need to rule out other pathologies and focus on lactose. For example, the history itself is very suggestive. Whenever a patient takes high milk diet, he develops symptoms. When he does not take high milk diet, he does not develop symptoms. It itself is almost confirmatory of lactose intolerance. Now, you know, there are many diseases in which you should suspect lactose intolerance as the cause of symptom. For example, post GI infection. A patient had gastroenteritis, his diarrhea subsides, his vomiting subsides, his fever subsides, he has no pain abdomen. But then he has started noticing that he cannot digest milk or milk products. Why? Because he has developed lactase insufficiency because of intestinal infection. Okay, and this is likely to persist for at least 2 to 3 months. So what do? We just stop milk and milk products uh, in such scenario, or if the patient is very fond of taking milk, we can give lactase chewable tablets. Similarly, in case of IBS or inflammatory bowel disease, which like Crohn's disease, which affects the upper intestine also, you have lactase deficiency as cause of symptoms. Now, supposing we do not diagnose, we do not pick up our cases, our patients of lactose malabsorption, and we do not suggest them the remedies, what can happen in short run and long run? See, in short run, there is hardly any impact, but in long run, certainly there is a visible impact on quality of life. Long-term dairy products, if you avoid, you can develop osteomalacia, osteoporosis, vitamin D and calcium deficiency, and riboflavin deficiency. Lactose intolerant patients may have unhealthy weight loss and cause increased risk of developing fractures. Similarly, patients who are lactose intolerant may also develop depression because of constant dyspepsia. In another report in 2018, it has also been described that long-term lactose malabsorption may lead to what is called as leaky gut syndrome. And this leaky gut syndrome invites a lot of autoimmune disorders in the body. So, lactose intolerance may have a far reaching long term impact in our lives. How do we manage? Milk dairy avoidance is a simple thing which you can advise in short run, not in long run. Okay, and I think when we should uh, manage our patients uh, by trial and error method, we identify their tolerance levels. Okay, like we can ask them, drink 1 glass of water, don't drink 2 glasses. If you are feeling fine, then we know your threshold. If a patient develops symptoms after 1 glass, we can say, please take half a glass or a small cup at a time. So this way we can find out their threshold. Okay. So as we discussed earlier, up to 10 to 12 grams of lactose can be tolerated easily. Otherwise, if a person is wanting to have more milk or milk related diet, then lactase enzymes tablet or what is called as lactase replacement therapy is available now in market. So I think we can skip this. So what is lactase replacement therapy? Patients who ingest more than 1 cup of milk daily and they have symptoms, they can be given commercially available preparations. Okay, and these are chewable oral lactase preparation tablets. They they can be taken right at the time of consuming milk or milk products. They are very safe and virtually have no side effects. You can get commercial lactase from various sources, but lactase from Aspergillus oryzae has high activity throughout the GI tract, even in the stomach where pH is highly acidic, unlike some other formulations which are unstable at low pH. So the lactase which is obtained from Aspergillus oryzae is in stable in acidic environment and there is high activity and this is recommended by European Food Safety Association and US FDA also. Dr. R.K. Tandon and Dr. Bajal conducted this study, and where they actually found out that lactase is very beneficial effect on symptoms of lactose intolerance in the Indian population also. So, ladies and gentlemen, this is a brief algorithm. If you have a patient who's complaining of bloating, dyspepsia, borborygmi, uh, crampy pain in your clinic, and if patient relates it to milk or milk products intake in the history, then you can either empirically treat your patient for lactose intolerance, or to confirm, you can go for baseline hydrogen blood test if it is available, and then uh, you know uh, you can treat your patient with replacement therapy. Okay, so this is another study from Europe, again attesting to benefit of lactase preparation in lactase deficient patient. And this cartoon also shows you the effectiveness of lactase chewable tablets in breaking down the lactose or milk. So this study also confirmed that lactase enzyme replacement brings down the symptoms of lactose intolerance and bowel movement in up to 90% of patients. Okay, I think I should not burden you with the results of too many studies, and we come to summary. To summarize, more than one third of Indian population has lactase deficiency. It may not be manifest in terms of symptoms in everyone. Lactose intolerance is diagnosed mainly by the symptoms, but we have confirmatory tests in cases, in situations. We need to do these tests uh, to rule out other possibilities and confirm lactose intolerance. Milk and dairy avoidance is not recommended as it may lead to nutritional deficiencies and in the long run can lead to poor bone health and depression. Total avoidance is not possible due to hidden lactose in most of the Indian diet. Most of the GI diseases like GI infection, IBS, and IBD can also lead to lactose intolerance, and lactase replacement helps the lactose intolerant patients and patients of GI disease uh, enjoy the milk and dairy products. Okay, so we have already discussed, and just to be very, very brief, that lactase obtained from Aspergillus oryzae is considered the best source for lactase enzyme. Okay. Thank you very much for your kind uh, time and listening. If there are any questions, I would be very glad to answer them.
Thank you, sir. Thank you, sir, for such a elaborate presentation on this topic. So we have received two questions from our message section at
Yes.
YouTube. Sir, are these tests available at the government institute, especially lactose hydrogen bread test?
No, lactose hydrogen breath test is not available everywhere, and of course, it is available at prestigious government institutions like All India Institute, etc. It is not difficult to establish also, but by and large, you know, this uh, and this particular principle is used to test for many other things like carbohydrate malabsorption, intestinal transit time, etc., etc. So, but in many hospitals, it is not being offered as a routine.
Okay. And and sir, but the next question is, what is the cost of this hydrogen bread uh, test for one session? Like,
Yeah, hydrogen breath test is done over a period of 3 hours. Every half an hour, a breath sample is taken. Apart from the baseline breath sample, you take six more samples, one after half an hour. So it goes for 3 hours, and the cost varies. Cost is between 2,500 to 5,000 rupees
so thanks.
in many private hospitals. In government hospital, it's bound to be free of cost.
Yes. So next question is from Dr. Preeti. She writes, so in cases of celiac disease and in cases of gluten sensitivity and enteropathy, uh, are these patients also lactose intolerant?
Certainly, certainly. You see, the gluten enteropathy affects duodenal mucosa the most, and then small intestinal mucosa. So, and the most of the lactase is housed in duodenal mucosa. With destruction of duodenal mucosa due to gluten-induced enteropathy, the lactase levels will certainly be very, very deficient. So, uh, if many patients with celiac disease will have very typical symptoms of dyspepsia, bloating, etc., when they take milk or milk products. Certainly.
Yeah. Sir, the next question which we have received is that how to rule out SIBO, small intestine bacterial growth, and how to rule out before making the diagnosis of lactose intolerance.
So this is a very important question, and I think I should discuss it a little in more length. Because when we sit in our clinics, we get very very typical symptoms. Patients with typical symptoms like patient will say, मुझे गैस बन रही है, मेरा पेट फटा जा रहा है, मैं बाहर का खाना नहीं खा पाता, जब भी मैं बाहर खाना खाता हूँ ये मुझे सिम्टम्स हो जाते हैं, etc etc. Now a clinician can think of various possible reasons. Clinician can think of food allergies, clinician can think of simple roundworms, subacute intestinal obstruction, tuberculosis, irritable bowel syndrome, anxiety, and of course, lactose intolerance. So now, and of there is something also called small intestinal bacterial overgrowth. Right now, the the syndrome of small intestinal bacterial overgrowth in itself is not an independent entity. You see, this bacterial overgrowth can occur without any structural problem or without any even dysmotility problem. If you use proton pump inhibitors for a very long time in high doses, you develop small intestinal bacterial overgrowth. Okay, so whether these symptoms are because of SIBO or not, it is difficult to establish. You can demonstrate SIBO by doing breath test, number one. You can also obtain the bacterial cultures on endoscopy, particularly from duodenum or proximal jejunum, and send them for cultures, which is not routinely done. Or you can also treat your patients with rifaximin, that is a luminal antibacterial. And if the patient improves tremendously, this may also suggest small intestinal bacterial overgrowth. In my practice, I would think of small intestinal bacterial overgrowth if there is a mechanical obstruction or if there is a reason for suspecting intestinal dysmotility or there is evidence of multiple diverticuli which results in accumulation of bacteria in that region. I hope I have been able to explain.
Sir,
In this scenario, again, ladies and gentlemen, when you have treated your patient with rifaximin, patient does not improve, patient, and there is you are not sure of the diagnosis. Think of lactose intolerance, and that is what I have learned when I was preparing for this seminar. When I was reading for this webinar, then I suddenly, recalled my own patients in whom I did not suspect lactose intolerance. But now onwards, the symptoms are so similar, and it is so easy to actually treat a patient with lactase preparation and see the impact. If your patient improves tremendously, you are dealing with lactose intolerance and not with SIBO or not with IBS. Very simple.
thank you, sir. Thank you. Sir, I think we have done with all the questions. And with this, we come to the end of our afternoon webinar. And I would like to give a vote of thanks to Dr. Deepak sir on behalf of Walter Bushner Healthcare Foundation and on behalf of all the audiences and delegates who have been the part of today's webinar. Sir, we thank you, sir.
Thank you
Thank you,
for
sir. Thank you, sir.
invitation. Thank you.
Thank you, sir.
Thank you so much, sir. And once again, thanks for all the participants who have joined us for this interesting webinar. So, sir, if you allow, can we stop this session?
Sure.
Thank you, sir.
Thank you so much, sir. Thank you.